Good afternoon, everybody. Daniel Siegal here. Excited to be talking to you all this afternoon about some of the work we did on incidental findings and actionable findings management with a great company called Agamon. If anybody can tell me if the USA scores another goal, just put your hand up and we can all cheer, but otherwise hold your applause. A little bit of background about Henry Ford Health System. If you're not familiar, it's a fairly large integrated health system based out of Southeast Michigan. The radiology department encompasses 6 hospitals, a health plan integrated within the medical group, doing about $6 billion in annual revenue. There's over 6,000 physicians across 250 locations, again covering about 75 miles of Southeast Michigan. We do about 1.5 million scans a year across 61 different imaging locations. So fairly extensive, covering all modalities, all different kinds of things. And much like I'm sure your practices, we come up with a lot of imaging recommendations. Somewhere between 10 and 12% of our reports contain at least one imaging recommendation. And the interesting thing about these, and the reason why we got to be working with Agamon, is not all of these are appropriately followed all the time. You can see the breakdown here of a large percentage of these being CT and a fairly large percentage of them being MRI. These are important studies that patients need to have followed up in a timely fashion. Radiologists are making these recommendations, and it's really important that if they are saying they get done within a certain time frame, that these patients go and get these done in the appropriate time frame. Unfortunately, at baseline, about 65% of patients don't complete their follow-up within the recommended time frame, and that leads to delayed diagnosis, potential increased medical legal liability, and missed revenue. These are studies that have good evidence that they should be performed, and we would ideally like them to come back and get them performed within our system, as I'm sure you would all like to have within your systems. What we did when we began our journey with important actionable findings follow-up, before we started working with Agamon, was we created I'll call it an intermediate solution, where we had our radiologists actively flag reports with recommendations. And we built an internal solution that used some fairly simple keyword search to extract recommendations. And we actually hired and created a staffed office, which we called our Rad Assist office, which worked and managed these findings and made sure that any recommendation that was important and actionable got completed. We sent a lot of emails, did a lot of nudging to clinicians, and it was quite effective. We improved our follow-up rates significantly, from about 35% to about 85%. And we were very happy with that. The quality improved, the patient care was good, our providers were engaged and understood the value of the system, but here's the problem. It was quite manual. It was inefficient, it didn't really scale well, and there were a number of false negatives. We were missing recommendations because, for whatever reason, radiologists were not flagging them actively to put them in the system. Only about 20% of the really, truly actionable findings were ending up in our database. And even with that, we were still months behind schedule because we were manually approaching this problem. It required our staff working in this Rad Assist office to access multiple systems, Epic, email, because it was home built. We didn't have great integration, we didn't have automation. And what this really highlighted is the need for automation, to make this a truly scalable solution, to make sure that any important actionable finding, no matter where it comes from, what kind of modality, who's recommending it, what time frame, is found, is put into a queue, and the appropriate responsible provider is notified. So we started looking for a partner, somebody who understood how to automate this, how to find the important information that's buried in the free text. It's all there, but you need a good natural language processing tool that can identify it and pull it out, understand that context. So what modality, what time frame, where the imaging should be done, how frequently it should be done, to communicate that to the appropriate responsible provider, which may be different from the care setting in which the recommendation originates. Often we find things that start in the emergency room or the inpatient environment that are much more appropriate to be followed up in the outpatient world. And then automatically manage and close that loop, whether it's 3 months from now, 6 months from now, 12 months from now, to actually reach out and nudge that patient or that referring provider when it is appropriate for that exam that has come due to get done. And if it doesn't get done, to continually, nicely, nudge them so that it does get done. And then Agamon has created some really nice dashboards, which I'll show you a little bit of in a second, that help us analyze how we're doing on all of these actionable findings. Are they actually getting completed in a timely fashion? And help us understand the breakdown of what kinds of things are coming out of these recommendations and where are they being performed. So the results have been really nice. We're seeing increased adherence, more cases identified, and essentially minimal cost to scale because it's an automated software algorithm based on workflows that we already had in place. And we're having really pleased with the zero impact on the radiologists and primarily the improved efficiency for for our coordinators. So it has been a wonderful partnership, and we're really excited to see some of the increasing automation that Agamon has started to put in, which is, I think, going to be really, really effective in helping us scale this even further. Just a quick example of how this works. If you want to take an example of a patient who showed up in May for a CT of their abdomen and pelvis, the radiologist might have found a cyst, in this case a 1.6 centimeter cyst, and made a recommendation in the free text, either in the findings or the impression, doesn't matter where, and had actually indicated a due date for June. But June 14th came and went, and the patient hadn't received their CT. What Agamon does in the background automatically is recognize that this recommended action has not occurred, knows who the referring provider is, reaches out, notifies them. That provider who owns that care relationship with the patient is then notified and can contact that patient and say, hey, did you know you were supposed to have this CT done? Often the patient forgot, didn't have it on their calendar, forgot to make the appointment. It's that gentle, continuous reminder until they actually get it done that's so important to close the loop and make sure that they actually do come back and get it done. And in this case, the patient came back, the cyst had increased slightly in size, and they're going to continue to follow it. We don't know yet what this one's going to be, but a number of these will grow, and a number of these will end up getting an interventional procedure to biopsy and hopefully identify something that can be managed at a stage where it is more appropriately managed. A nice example of some of the data that Agamon has been able to provide us, which, when you think about from a socioeconomic perspective, the challenges with getting some of our patients, especially in the southeast Michigan area around Detroit, to come back and have their imaging performed, is really interesting to look at by zip code, by county, and helps our team now understand how to deploy some of their resources to better engage with patients in the community in different areas and understand some of the access issues, some of the other factors that might make it harder for them to come in and get their follow-ups done, and really identify where our resources need to be deployed to make sure that the right thing is being done for the patients and that there are no delays in diagnosis due to recommendations that we make. And this is another way of looking at ways in which health equity gaps can be narrowed by examining this data. And what this graph is really showing is that the adherence rate for low-income demographic were less than half as compared to those higher socioeconomic populations, which is not surprising when you think about the access and the other kind of socioeconomic factors that can impact these patients. But what Agamon has been able to help us really do is double that adherence rate for the low-income population, which is really impactful and really important, especially if you're dealing with inner city or rural or otherwise disadvantaged populations that are having a harder time getting in to do these kinds of follow-ups. So super important data now coming out of this platform about how we're doing managing these patients. So that's a short story, but in summary, I think if you are looking at doing an program to help your practice or center manage these important actionable findings. And notice I call them important and actionable, not just critical findings, because most of these are findings that need to be managed far out in the future, 3 months, 6 months, 12 months in the future. Those are the difficult ones. Those are the ones that often get lost in the shuffle, and those are the ones that there are lots of. So I would say pay attention to those, and pay attention to the value of automating how you can communicate these kinds of findings, because that's what will make a program like this successful. And I will tell you from the experience of having built one of these from scratch before working with automation, it is a true pleasure to work with a group like Agamon, and I know they're sitting in the audience here. Please feel free to find them afterwards or go track them down at their booth. They're wonderful, and we are pleased to be on this journey with them. There's a lot more that can be done with getting good, actionable findings working for as many folks as possible in a scalable and sustainable way. Thank you.
Thank you.
Thanks.